I've been mentioning where cranial nerves exit or originate on the brainstem, and this is an overview of our cranial nerves. You need to know them by number and by name. You should know what their sensory function is, if they have one, if they have motor function, and if there is parasympathetic nerve fibers. For instance, the oculomotor nerve has both motor and parasympathetic fibers, versus our olfactory nerve and our optic nerve are just sensory. For instance, our trochlear nerve is just motor as well as our abducens. Our facial nerve is all three. And our same as the glossopharyngeal nerve and the vagus nerve versus accessory and hypoglossal are just motor. So kind of being able to play in that world of knowing who's what, placing things in buckets will really help. We're going to go through our individual cranial nerves. So, cranial nerve one is our olfactory nerve, which is our sensory nerve of smell. It runs from sensory nerves that are located in the nasal epithelium to these olfactory bulbs, or this olfactory bulb, which we can see here. The olfactory bulb will then, or these sensory nerves have to pass through the cribriform plate of the ethmoid bone, a key anatomical landmark, and the fiber synapse in the olfactory bulb, and then this bulb extends posteriorly as the olfactory tract. This tract, again, something that's moving through the central nervous system, will terminate in the primary olfactory cortex, and this cranial nerve is purely sensory function, purely function for smell. Our optic nerve comes from the retina. It's really a brain tract, though. It passes through these optic channels and it converges and partially crosses over at the optic chiasma. We can think about this because this optic nerve, we see these red fibers cross over, but the blue fibers stay on the same side. The red fibers are kind of in the medial portion or the internal portion, and they're the fibers that cross over. We see these blue fibers here, this medial portion, are the ones that cross over, and then the lateral components are staying on the same side. So this is our optic nerve, and then when it crosses over at the optic chiasma, from here back to kind of these little bulbs are going to be called optic tracts. The optic tracts go to the thalamus, and that's where they synapse. And we can see them synapsing in the lateral geniculate nucleus. So that's the specific place that these fibers synapse. And then they send out radiation fibers that then innervate to the visual cortex in the back of the brain. This is purely sensory visual function, and we test it with our visual field tests. Our oculomotor nerves, these fibers extend from the ventral aspect of the midbrain through the superior orbital fissure. That's an important anatomical distinction. And it goes to four of the six extrinsic eye muscles. It helps with raising the eyelid, directing the eyeball, constricting the iris, that's parasympathetic, and controlling the lens shape. Um, if there's damage to this nerve, you'll see that eyes are unable to move up and down as well as inward. There'll also be challenges with focusing the pupil and an upper eyelid droop. Specifically, the muscles that are innervated here is the inferior oblique muscle located here, the superior and inferior and medial rectus muscle. So we have our inferior rectus muscle, which is here. We have our medial rectus muscle, which is here. And we have our superior rectus muscle, which is here. So those are the muscles that are essentially innervated by this oculomotor nerve. Our trochlear nerve is also going to be doing eye movement. Their fibers from the dorsal midbrain also move through the superior orbital fissure and innervate only one muscle, the superior oblique muscle up top. This is just somatic motor. It's the primary motor nerve that directs the eyeball, and it can also receive proprioceptive information from the superior oblique muscle. We see that if there's damage to this nerve because this fiber, let's see here, we'll see damage to this trochlear nerve can lead to double vision and the inability or impairing the ability to rotate our eye inferior and laterally, so down and out. Our abducens nerve has fibers from the inferior pons and that it's cranial nerve 6, and that enters the orbit as well via the superior orbital fissure. And it's also primarily a motor nerve. It's innervating the lateral rectus muscle, which we can see. We don't have a good picture of it. It's cut back, but the lateral rectus muscle here. Then moving to the trigeminal nerve, this is the largest of our cranial nerves, and it's extending from the pons to the face. There are three divisions. 5-1, or the top divisions, are ophthalmic division. This passes through as well the superior orbital fissure. Our maxillary, or 5-2, passes through the foramen rotundum, and our mandibular, V3, passes through the foramen ovale. These are focusing on sensory impulses from various areas of the face and sensory information, and also can supply motor fibers, only mandibular, for mastication, the muscles of mastication. All divisions carry sensory fibers from the face, pain, temperature, and touch. And the mandibular division supplies somatic motor fibers to the muscles of mastication, as well as carries proprioceptive information from those muscles as well. The facial nerve is helping with facial movement. The fibers from the pons travel through the internal acoustic meatus, and they emerge through the stylomastoid foramina, and then they go to the lateral aspect of the face. They're the chief motor nerves of the face. They have 5 branches, and you can see these 5 branches here in this image. And the motor functions are facial expression. There's also parasympathetic impulses to our lacrimal and salivary glands, and sensory function taste from the anterior 2/3 of the tongue. Our cranial nerve 8 is the vestibulocochlear nerve. Um, Afferent fibers or afferent fibers from our hearing receptors, the cochlear division, and our equilibrium receptors, the vestibular division, pass from the inner ear through the internal acoustic meatus, and they enter the brainstem at the pons medulla border. This is primarily sensory function. There is a small motor component to adjust the sensitivity of the receptors. Our glossopharyngeal nerve is cranial nerve 9. Fibers from the medulla leave the skull via the jugular foramen and run to the throat. And this innervates part of the tongue and as well as the pharynx, helping to swallow and also providing parasympathetic input to our parotid and salivary glands. The sensory function, the fibers conduct both taste and general sensory impulses from the pharynx and the posterior tongue, and impulses from the carotid chemoreceptors and baroreceptors. Our vagus nerve is the only cranial nerve that extends beyond the head and neck region, and fibers from the medulla exit the skull via the jugular foramen. Most motor fibers are parasympathetic and they help regulate activities of our viscera. And there are some sensory fibers that carry impulses from those viscera, including also baroreceptors, chemoreceptors, and even taste buds of the posterior tongue and pharynx. Our accessory nerve, cranial nerve 11, is formed not from the brainstem. It's unique. It's from ventral or anterior rootlets from regions C5 through or C1 through C5 of the spinal cord, not the brain. And these rootlets pass into the cranium via the foramen magnum. The accessory nerves exit the skull via the jugular foramina to innervate the trapezius and the sternocleidomastoid muscles. So they come off the spinal cord, they go up into the brain, inside the skull, then they come back down, and then they innervate these muscles. This is formerly the spinal accessory nerve. And lastly, cranial nerve 12 is the hypoglossal nerves. Fibers exit from the medulla via the hypoglossal or hypoglossal canal. From there, they innervate the extrinsic and intrinsic muscles of the tongue that contribute to both swallowing and to speech. And you can see these cranial nerve locations. Again, you won't have to look at a picture and label, but you should understand where they come off of and what structures they travel through to get to their final location.